Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to help educate you and your families feel better, to function better, and to live as many quality disease-free years as possible. Thanks for joining me this week, and hopefully you've been enjoying the last 4 weeks, where this is show number 5 on structural integrity. This is a foundational show. By Design has foundational shows and has topical shows. So I've really been digging deep into this foundational subject matter of structural integrity. We started off by breaking the cell apart and learning about the human cell, which is the miracle of God. And now we're looking at it from more of the day-to-day apparatus of our physical being, the physical medicine, the physical matter that we have, our musculoskeletal movements, the way we turn our head, bend and lift, and have power and strength and speed, and all of those wonderful things that our human bodies were designed to do, and how so many of us are dealing with chronic pain, the day-to-day, week-to-week kind of pain that is non-traumatic. Like I shared with you, it's pretty simple to understand that, hey, we sprain our ankle, we go to the doctor, we get an x-ray, we might have to be casted or braced. We use rest, ice, compression, and elevation, which is basic first aid for a sprained ankle, and it heals, and maybe have to do some physical therapy and such. And the macro traumas of life, which are like car accidents and broken bones, we understand. Having surgery is a macro trauma. But the micro traumas, the day-to-day, and last week we talked about the structural integrity of just sitting too long. And what we walked through, we ended up talking about the health of our ligaments, where the muscle begins to degenerate, it begins to atrophy, which means decay. We lose muscle mass as we age, because so many Americans are sitting behind desks 8 to 10 hours a day, then sitting behind a TV, sleeping. All of these activities, even though we require sleep, my point is we're inactive. And we used to be farmers, right? The agricultural revolution up to 150 years ago, we were outside early in the morning lifting and bending and twisting and milking and doing all of the things that farmers do for a living. A very physical life. And physical laborers, many times are better off than the white collars who sit behind desks all day. Our body has to be utilized from a musculoskeletal perspective. And as we use our bodies every day of our lives, we're going to wake up and use this physical being, it can be used inappropriately. And the example I gave you last week, which is, going outside and lifting up a potted plant during gardening season, and we bend over at the waist and we use muscles in our lower back called the erector spinae. And they're not designed, they're not called the bend over spinae. They're called the erector spinae because they're meant to keep us erect. Our gluteus maximus, our muscles in our rump and our legs, they're designed to allow us to squat down and pick up a heavy object. So how we use our God-given design is very important to prevent acute accidents, immediate pain, and chronic, which are more the micro trauma. So where we left off was that these ligaments that connect the spine, that connect joints together, very strong structures, were not designed to pick up the burden of the failing muscular system. Muscles begin to degenerate and weaken, so the ligaments pick up the slack and it produces pain. And remember Luke 1:37, for with God nothing is impossible. So we have to allow our bodies to be as resilient. They're as resilient little creatures, and these resilient bodies can respond. They can improve. They can become empowered. They can become stronger. They can become faster. But we have to apply the proper knowledge, the proper literacy in order for that to happen. Because as the ligaments begin to fail and the muscles are weakening, what we're actually doing is turning on pain receptors, which are neurological receptors located throughout our entire body. And we have these pain receptors on our bone, we have them on our ligaments, we have these pain receptors in our discs, for instance. And if a body part is injured, whether it be macro or micro trauma, we're turning these bad guys on. And they're bad because obviously they're producing pain, but they're actually good because they're giving you a sign. Hey, something's wrong down here. Sitting on a big fat wallet like so many guys do for 20 or 30 years eventually can produce sciatica pain down the leg. It could produce back pain. The sciatic nerve is the largest nerve in the human body. It's a thick rope when you hold it in your hand. And this is a significant problem in so many Americans who have pain and tingling and numbness going down their leg. So we don't want to turn these pain receptors on. And one of the ways we do that is our bodies decay, we become degenerative, we lose disc height, the muscles begin to fail, we put on too much body fat, and then what do we expect? What we should expect is that ushers in chronic pain. So these pain nerves transmit pain. But you see, you also have another type of nerve, and they're called mechanical nerves. And the mechanical nerves, when we turn those on, see, they inhibit pain. They relax tight muscles, and they improve coordination. So we want to get to this balance. How do we do that? Well, proper physical exercise, proper biomechanics, proper structure, and posture can help the balance between turning off those pain nerves and turning on the mechanical nerves. And if we go back to last week's show, I shared with you something that Roger Sperry said. He's a PhD and a winner of a Nobel Prize in brain research. He said the more mechanically distorted a person is, the less energy is available for thinking, metabolism, and healing. So mechanical distortion, guys, is what it's all about. This is outside of macro trauma. We want to not be mechanically distorted. We want full range of motion of our neck and our lower back and our elbows and our knees and our wrists and our ankles. Because what ends up happening in this, what I'm describing to you, is what's called immobilization. Immobilization is the process in which so many people are on this path of immobilization. We go to school, we're typically active children. When I grew up in the 70s, go outside and play. Remember those days? You were just always active. Now our children are less active. They're more sedentary. They are more immobilized. Then we go off to college, we get a job. If it's a sedentary job behind a desk, we sleep 8 hours, we have a desk job 8 to 10 hours, we watch TV a bunch of hours, not a whole lot of time to have that farmer mentality, to be active, to be doing activity. So this lifestyle of immobilization, well, who cares, Proodian? Well, here's what happens when this happens. It causes joints to actually shrink. So joints are meant to be mobile. They're meant to not contract, and which leads to fibrosis and irreversible changes due to immobilization. Ligaments, like I shared with you in the last show, the fibers actually thin. So a thick fiber will actually become thinner, which leads to weakness, which leads to joint capsule shrinkage and also ligamentous failure. Okay? The bone density decreases in an immobilized state. Osteopenia, osteoporosis. And this is coming from somebody who touts vitamin D, and vitamin D is essential for bone health, as is the right form of calcium. But without physical exercise, with immobilization, that bone density will decrease. In my upcoming shows, I'll be doing some shows on osteoporosis. Bone is a real live living organism. It is not like Dino in the Flintstones holding this solid white mass in his mouth. Bone looks like cheesecloth under a microscope. There's stuff coming in and out of it all day long. We want to keep the good stuff in. We want to keep it positive. So immobilization or a sedentary lifestyle causes bone density decrease. Next up is muscle. I shared with you muscle atrophies. Muscle mass gets smaller. Hey guys, if we're going to learn anything today, remember, the more muscle you have, the longer you live. It's as simple as that. We always want to be conscious of enhancing muscular development. We always want to be working on our muscularity with physical exercise. And I don't just mean cardiovascular exercise, which is very good for circulation and heart. I mean anaerobic weightlifting, particularly to you ladies out there. Very, very important, especially prior to menopause, because estrogen is essential in enhancing muscular development, and as estrogen decreases very abruptly during menopause, you lose muscle mass. With men, we start losing testosterone over the age of 30, and it's a slow decrease. Women, it's more abrupt with the estrogen. Next up is our cardiopulmonary output. In an immobilized state, our cardiopulmonary output, what happens is our heart rate increases, which is what we don't want. We don't want to make our heart work harder at rest. While we're at rest, we don't want our heart pumping, over 80, 90, 100 times a minute. The normal, for resting heart rate is 60 to 100, but I like to see my patients around 60 to 70 or even below 60. And what it also does, this cardiopulmonary output puts a lot of demand on our lungs and our hearts to work harder. So that is another negative effect of immobilization. And then finally, our spinal discs. 1/3 of our spinal height is in the discs. The discs are the shock absorbers between each vertebrae. Between every vertebrae in the human body, there is a spinal disc which allows bone not to touch bone, because you never want bone touching bone in the human body. That would be very painful. So each one of our vertebrae are separated by the vertebrae above and below it with a spinal disc. Well, spinal discs degenerate. They wear thin in an immobilized state. So this immobilization process causes a whole host of things to happen, especially those intervertebral discs and muscles. They degenerate, now check this out, without any symptoms. Any symptoms, they're degenerating. They produce what's called asymptomatic disc degeneration. In Latin, when you put a in front of a word, it means without. So asymptomatic means without symptoms. Our discs are degenerating. We're reducing the amount of water inside the disc, reducing the discal height. That causes the discs to, they can prolapse. They could also protrude, become bulged and herniated, which presses nerve tissue and causes pain. Asymptomatic muscle degeneration enhances fat deposition. So we do not want to deposit more fat, and that's what happens as we lose muscle mass. So as this is happening around our spines and around our joints, we become deconditioned. So now, today's show, structural integrity, we talked about ligament and nerve and muscle and bone and cardiopulmonary output and spinal discs. And as this immobilization process is happening, we are deconditioning, follow this, many times without pain or symptoms. And we end up getting a pain or a symptom. Hey doc, I bent over to pick up the pen, my back, quote unquote, went out. I never understood where your back goes out to. It goes out to where? Does it go out to lunch? So I never understood that one. But when we have these expressions like, I have a slipped disc or I have nerve pain, people use these commonly, musculoskeletal pain, what their aunt or uncle told them is going on with them. This is serious stuff. If we're in a deconditioned state, we better get on the bandwagon of reconditioning. How do we recondition a deconditioned state? Well, resetting the muscles is a great place to start. We want to change the length of those postural muscles through specific motion. Motion is what the joints and the muscles want. Give it to them. It wants the motion. Now, changing the length of the postural muscles is one of the reasons why a massage feels so good. Somebody is actually mechanically changing the length through an external stimuli into the muscle. And so anyway, that's one of the reasons why somebody starts rubbing your shoulder, it feels good. Resetting those muscles, those postural muscles, prior to excessive tension or prior to exercise is essential. You don't want spasm to set into a muscle. So don't go into any activity cold. All right? Simple things around the house. If you have a headset at the office, much better than having a handset, where you have to tilt your head to the side. You don't want to put your body into mechanical distortion. Taking your monitor and raising it up so that you have a lateral eye gaze, so you're not looking up or down at the monitor. You know, I notice in people's homes right now, it's wild. They're sitting on a couch and they're looking up at a TV set over a fireplace. You know, it might look nice up there, but you're putting your head in extension watching TV for a long period of time. Really don't recommend it. Taking micro breaks at the office. That means get up, move around, do wall squats. You know, put your back against the wall and squat down a few times. Stretch out your hamstrings, stretch out your hips. I shared with you last week on drproodian.com, which is my blog site. I did some blogging on this recently. Micro breaks, very, very important. Stretch out thoroughly. Don't sit in a position for 8-10 hours period of time without taking these micro breaks. Do not bend over to pick up anything. Please, the most important thing you could learn how to do is to learn how to squat. Now that means you might have to watch something online or go to a therapist, someone like myself, and learn the proper way to squat. It will preserve your lower back. Because positioning with your knees bent is essential to preserve our lower backs. So those are just some easy tidbits that you could use, along with sleeping positions. Never sleep on your stomach, only sleep on your side or your back. You don't want to use too much pillow, you don't want to use too much pillow. You want your nose, your breastbone, and your belly button in a straight line if you're laying on your side. You don't want to prop your head up too much if you're laying on your back. These positions are very important to not only prevent the pain from setting in, but also dealing with it when you have it. Guys, thank you very much for listening to the By Design radio program and myself, Dr. James Proodian, for this episode. Please go to ProodianHealthcare.com for more information. Have a blessed week. Do something new this week for your friends and families, and please stay active. God bless.